So, hello and welcome everyone. Good afternoon. Hope everyone is doing great. Welcome to the Wellbeing Series, Session 2. My name is Tej Rana, and I'm currently the president for FES Miami chapter, if you don't know me. And what we are doing today is part of our Wellbeing Series, which we started with the aim that we wanted to support the well-being of all engineers along with the professional interests, which I know FES does very well, but we wanted to add this component about the well-being aspect for every engineer. It doesn't matter every engineer, but every being for that matter. And part of our series, the second session we are doing is on mental health tools for engineers. And is mental health tool for engineers. Now, one of the things I have learned over the years is that um, with well-being, based on extensive research, there are 5 ways of well-being which have been identified. And as I move forward, you can see on your screen the 5 ways of well-being which has been identified based on extensive research, and you can see it's different 5 different options here: give, be active, connect, keep learning, take notice. So I'm not going to go too deep into this. The words themselves give explain a lot about what they mean, and we all understand how each of these things can be so incorporative and fulfilling in the regards. And I'm sure we all have seen the benefits of each of this thing. But what I want to do is I really want to introduce our speaker and presenter for this session, who I feel, and my understanding of them, which is NAMI, National Alliance for Mental Illness, which is a national organization, an NGO, and we have the fortune of having their Miami-Dade region representative, Kate, here with us, Kate Edelson, who is the director of fundraising and special events at NAMI Miami-Dade, and she oversees the planning of their Walk for Mental Health Awareness event, which is a big event. If you have not been to that one, even the mayor Daniela, she attends this event and is there to support this event. And also the Real Minds Mental Health Film Festival, which I know Kate will be talking about as we move forward. Um, and she's been with NAMI for 6 years, and she started as a volunteer, and she's a South Florida native. So I want to really welcome NAMI, welcome Kate, because I know they are someone that's an organization who does a lot from all these 5 ways of well-being. And they provide the opportunities to give. They are someone who will give you opportunities to be active, to connect, and to learn new things, and also to take notice for that matter. So let's welcome Kate, and I'll pass it on to her to take us forward and share a lot of what they do and the mental health tools they offer. Kate, over to you.
Thanks so much, Tish, and thank you so much for having me, everyone, and for having NAMI Miami be a part of your FES Wellbeing series. It's a pleasure to be here, and I'm really excited to share everything about NAMI with you guys. I love this organization so much. Like he mentioned, I've been working here for 6 years, but I started off as a volunteer at the national level as a helpline volunteer. So at the time I was in college and dealing with a lot of mental health stuff myself, and I actually had to hospitalize my roommate who had a bipolar episode for the first time when we were roommates together. And ever since then, I've felt very dedicated to learning about mental health conditions and understanding what resources are available and helping others as they go through their struggles as well. So I'm a big fan of this organization, and I think it's very much in line with the 5 principles that you just mentioned. So I'm very excited to share this information with you today. And will you be going through the slides? Yes, okay, thank you. So we are the Miami-Dade affiliate of the National Alliance on Mental Illness. So we serve Miami-Dade County, and we technically serve the Keys as well. We are a group of individuals who have been personally touched by mental health conditions. So we're not mental health professionals, though sometimes, of course, those two things overlap. We are people who have just had mental health experiences either through ourselves or through with family members, and we use that experience to help other people. So NAMI National provides us with evidence-informed or evidence-based programming, and then we train people to be able to implement those programs and help others. As it says here, our mission is to improve the quality of life for anyone who is dealing with a mental health condition and provide support to their families as well through our programming, and everything that we do and that we provide to our community is for free. So these are our programs. We're going to go over some of them today. But as you see, we do a lot. The needs of our community are great. And there's a lot of different groups that we try to provide programming for. So we'll touch on some of these today. And I will mention that some of these are NAMI programs. So NAMI provides programs, but some of these are not. Some of these are programs that we've either developed or taken from other organizations. So for instance, you'll see QPR, Suicide Prevention and Awareness Training, comes from the QPR Institute, which specializes in suicide awareness and training. So oftentimes we have to be flexible when serving our community. And so that's one of the ways that we do that. So one of our main services is our helpline. I was in charge of our helpline for 4 years before I moved into my new role. It's a number, a 305 number. It's open Monday through Friday during working hours, and it's staffed by people who have lived experience. So our helpline is not a hotline or a crisis line. It's where people can call if they're looking for resources. So oftentimes people are either looking for therapists, or they're just looking for support, or maybe they're just at the beginning of their mental health journey and they don't know what to do. And so they can call us and we answer the phone in English, Spanish, and Portuguese, and we're able to point them into the direction of what they need, which is usually a host of different things. It might be that they're a family member and they're concerned about their loved one, and so we point them towards the mobile crisis unit, or it might be that they're looking for support and we point them towards our programs. So one of our main programs are our support groups, which are offered either virtually or in person. They're structured meetings, usually led by 2 trained NAMI leaders. And again, this is all coming from people with lived experience. So when you join our groups, you know you're surrounded by people who understand exactly what you're going through. So we have a bunch of different groups ranging from young adults to family members to those who are specifically caretakers of youth. We recently started an LGBTQ group, which we're really excited about. I'd like to emphasize that there is no diagnosis required to join. If you're just going through a tough time and you want to talk to people about it, you don't need to offer any proof. You don't have to have insurance. You don't have to pay for anything. The only requirement that we have is that you be respectful of others in the group, and that our groups are for those who are 18 years or older. And I believe the next slide will show you some of our groups that we have. So here you can see that we have them for peers, we have them for family members, and family members can mean the parents, the siblings, the kids, but it could also mean very close friend or spouse. So we use family loosely. A caregiver of youth might be a parent, but it might be an aunt, it might be a guardian, it might be a foster family, and our groups are open to anybody who fits the description of what that group caters to. And this is one of our most amazing resources because anyone can just hop in and do this. You can just go once, you can go every week, you can go every other week. There's really very little restrictions, and it's just a good resource to have in your toolbox in case you need support. So the groups are really about holding space and providing emotional support. What we also have are educational programs. And the way we think about this is a class. So this is really an opportunity for either peers, those who are living with a mental health condition, or families to get a lot of information about mental health diagnoses, treatment, understanding the system, legal information, and goal setting for some. So, clinicians have a lot on their plate, and oftentimes they don't necessarily have time to walk you through every aspect of dealing with a mental health condition. And family members usually can't talk to clinicians because of HIPAA. So we're here to provide the sort of information that a lot of people don't have access to. So the way this works is usually it's 8 2-hour sessions, again, taught by 2 NAMI trained and certified mentors with lived experience. Again, it's free, it's confidential, and we have peer-to-peer, and then we have family-to-family, which we also offer in Spanish. So that's familia de familia, and those are 2 different groups. This is probably one of our most popular programs, especially for family members who maybe struggled with accepting their loved one's diagnosis or didn't know how to help them and were emotionally involved and hitting a wall. This really helps people get a better understanding of, listen, this is a mental health condition. This is what it can mean. Many people don't know that people who are dealing with a mental health condition can sometimes be in denial because there is a part of a mental health condition called anosognosia, which literally prevents the person with the mental health condition from understanding that they're sick. And there are some really great resources out there to help family members understand this. But this is a key part for anyone who is struggling with someone they care about in their life and doesn't understand how they're dealing with their mental health condition. Knowing these things can make a huge, huge difference. So these courses are amazing. They're offered usually 2 or 3 times a year. They're free, and we have them in English and in Spanish. So the classes, like I mentioned, are the sort of educational aspect, and they happen for a short time and then they're over. The mentoring program is a little different. It's sort of that one-on-one aspect that a lot of people are looking for, again, offered to peers or family members. And it's pretty much exactly what it sounds like, one-on-one sessions with a peer specialist, so someone who's been trained through the Florida certification. And it's very recovery focused and goal oriented. So especially for those who are dealing with a mental health condition, who are maybe looking for accountability and support as they go through their journey, this person is there to meet with them and provide them additional guidance, support, help connect them with additional resources. Same thing for family members. Again, it can be very complicated for families to be going through this, to be supporting their loved one. Oftentimes, they see a reflection of their own mental health struggles, and that can be very difficult for them too. And so the family mentor is there to help make the process easier, to provide additional support, because family members and caregivers experience burnout. So it's really important to have that element as well. So this is one of my favorite programs. It's near and dear to my heart. When I first started off working at NAMI 5 or 6 years ago, one of the first things that I did was become an Ending the Silence presenter. And I loved this because it was exactly what I wanted to do. When I came out of college, like I mentioned, that was just one of the many experiences that I had was hospitalizing my roommate, and I became very passionate about educating teenagers especially about mental health conditions, because now I know that those between the age of 17 and 24 are most vulnerable to developing a mental health condition. And I didn't know that. And so when I was at the end of high school and going into college, and it felt everyone around me was very, very ill and no one knew what to do about it, I was like, what's happening? Now I know, thanks to this program, that it's actually very normal. And so NAMI goes into middle schools and high schools, so we can go into programs that focus on that age group as well. And we give a 50-minute presentation that helps the kids and the students learn, what is mental health? We talk about it a lot, but we really break it down in layman's terms for them to understand, and what mental health conditions are, what they'll look like, and what to do if they see this in themselves or their friends, because kids probably spend way more time together than they actually do with their parents in school. And so oftentimes they are sort of the gatekeepers of knowledge as to how the people around them are doing. So we help them learn what steps to take, and we connect them with the mental health coordinators that Miami-Dade Public Schools has as part of their mental health department. We also offer this to family members because obviously educating the kids is one step, educating the families is the next one. And so again, everyone who leads these presentations has had personal experience. So for example, for our Ending the Silence for Families, Our main presenter, Celia, she has 5 kids, 4 of which have serious mental health conditions, and the 5th one has TBI, which is usually very much like having a mental health condition. So they've really been through it with their family, but the benefit is that she understands the Miami-Dade system. She knows the clinicians, she understands the hospitals, she knows what it's like to work with the schools. So that information is very valuable to parents and family members who, may not be experiencing this with their kids directly, but maybe they know someone who does. 1 in 5 have a mental health condition. So this is very, very common. And ending the silence is an excellent way to educate people from people who know what it's like to have been there. And so we do this for kids, we do this for families and parents, and we have one that's specifically tailored for staff that work with youth. I mentioned QPR earlier. This is an incredible program that trains people to better understand suicide, which is, of course, a very difficult topic. And I would be remiss not to mention that this month is Suicide Awareness Month, which I'm sure you've all been seeing on LinkedIn and social media platforms. Unfortunately, this is the topic that just seems to grow and grow. And so we do a lot of outreach trying to address this topic. We also have a conference that is mostly focused on suicide awareness with a lot of speakers. Some of you may have heard of Kevin Hines. He jumped off the Golden Gate Bridge many years ago and survived. And so he is a motivational speaker who shares information about suicide and seeks to clear some of the stigma around it and help people understand why people do it, because this can be difficult to understand if you've never experienced it or seen someone experience suicidal ideation. So he came and he spoke at our suicide conference, and he was really incredible. So QPR is a 50 to 90-minute presentation. We can do it online or in person. Of course, in person always does have an extra component of just closeness and being able to connect, but the information is useful no matter what. So we teach people how to recognize when someone might be thinking about suicide and then what to do. One of the greatest misconceptions around suicide is that if you ask someone if they are thinking about suicide, you might give them the idea and could potentially do harm. This is not true. I can tell you that anytime someone is thinking about suicide and someone else recognizes that and offers support and wants to help, that is actually a huge step for them and is very meaningful. Just imagine that you're having maybe the worst day ever and you're not doing well, and you think maybe no one cares or that you're just a burden, and then someone approaches you and says, "Hey, I recognize that you're not doing well and I want to talk to you." It can make a world of difference. So that's really what this training is about. We teach people how to have that conversation. There are a lot of things that, go in. It can be very scary to approach that conversation. So we want to give people the resources and understanding of how to approach it. Obviously framing questions in a way that is going to help people is important. Saying, "You're not thinking about suicide, are you?" is not going to be helpful. There's a special way to do it. You want to take the time, you want to make sure it's private, and you want to know how to say it. So this is what we do. And then anyone who receives this training is a certified gatekeeper, which, nowadays online gatekeepers has a different connotation, but this is the good kind of gatekeeper. This is the kind of person that knows how to approach someone who might not be doing well and has the resources to help someone. So we are very proud of this program, CIT training for law enforcement. So what we do is we go into police academies and headquarters, and we share with them information about NAMI. That way, when they go out into the community and unfortunately still have to Baker Act, if you're not familiar with the term,
Yes.
it's either voluntary or involuntary hospitalization. When they're doing that, oftentimes, let's say it's the family that called the police, they can give them our information. So, imagine a loved one of yours hasn't been doing well and now has just been handcuffed by the police. It's a very traumatizing and difficult situation. And so at least we're there as a resource, and the police can give out information on us. So those family members can immediately follow up with us and get a better understanding of what's happening. So this allows law enforcement to have an awareness of who we are. I know that our police force is making efforts to change the way that they do things. I know that they don't want to be doing what they're doing, and they would much rather have mental health professionals dealing with crises. And as a community, we are working hard to change these things so that it makes sense for everyone. And like it says here, research shows that police officers that have gone through our CIT program, who have gone through the CIT program model, we're just coming in as part of it, have a better success rate in resolving serious crisis situations because, like it says in the five modalities, it's better to be educated, it's better to get access to resources, and that makes a better world for everybody. Ah, yes. So, signature programs, my special place. So, like I mentioned, we do a South Florida suicide awareness conference. This year we did it in March, but I believe the next one will be next September, which makes a lot more sense since that's Suicide Awareness Month. So, this last one was in March, but we will be doing it next September, which means we have a full year to prepare, which is great. Our two other events are the Mental Health Awareness Walk and our Real Minds Film Festival. Tej touched upon this. The Mental Health Awareness Walk is our largest event. It is also the largest mental health awareness event in South Florida. It brings thousands of people together, and our last one was at the zoo, and it brought together through about 3,500 folks, which is huge. I will say that 5 years ago, I was our outreach coordinator, and I was out in the community with my banner that said, the tablecloth that said, National Alliance on Mental Illness. And by the time people read mental illness on my banner, they were already walking away. And I would, be like, hey, no, it's free, I'm friendly. And they were just running away. So now to be organizing an event where thousands of people will come together to celebrate this is huge for me, and it's a great honor for me to be organizing it. And so the next walk for mental health awareness will take place May 10th at Marlin Stadium, which I am thrilled. I love the stadium. It's a great location. They're wonderful to work with, and it's just a great central part of Miami. This is an incredible event. We had 80 something sponsors and community partners last year. We raised $400,000, which is just incredible for us. It is an amazing opportunity for us to spread awareness during Mental Health Awareness Month. And as a nonprofit, it's very necessary for us to raise funds, especially ones where that are not grant related, so that we can use these funds to go into our office and our salaries and all of these things that usually we can't get support with. So this is huge for us. It's an amazing community event. We have tons of elected officials who take part, and it serves as a resource fair so that anyone who attends will see the 70 partners that we have present and be able to walk through and say, hey, do you take my insurance? What do you offer? It's a really fun and amazing event. So I hope that all of you will be able to join, and maybe you guys will be able to make a team. That would be great. So this is actually an outdated poster. Our logo this year is actually my shirt. It's with the butterflies. But the Real Minds Mental Health Film Festival is also a fantastic event, very different from the walk because it focuses on the arts, which is very in line with mental health. And we're really excited to bring it back because our last one was in 2019. We had one planned for 2020. This would have been the poster. But as you can imagine, it never passed. I'm really thrilled that we have the capacity to bring this back. We show short films all about mental health, and they say a picture is worth 1,000 words, but really seeing it on screen helps bring the message home in a way that nothing else really does. And it's great because this year we're actually showing 10 short films. They're really incredible. We watch them in the office, and some of them are touching and some of them are just funny. So we'll show a great array of these. And so tickets are on sale. We're still looking for sponsors, and we're also having volunteers. So it'll be October 20th at the Moss Center in the Cutler Bay area. And there will also be panel discussions. So we never just want to throw information at people. We always want to make sure that we can follow up with educational materials and resources. And so there'll be panelists who speak after the films who will address the topics. I will say one of the big topics that came up this year was panic attacks and anxiety. That was the one that we saw the most. I think we have at least 4 films that we're showing this year on that topic. And the things that we see through the film festival are usually a reflection of where we are as a society. So I think it's a really good opportunity for us to address this and to provide some needed information. So a little bit about how you can get involved. We have a lot of different things going on. As you can see, we have many different programs. Anybody can volunteer to do outreach. We are running all over the county and the Keys sometimes, trying to provide information about who we are and what we do and about our free programming. So we're always looking for people who want to help table at either our events or the events that we go to. And again, this can range from Miami Gardens to Key West most recently. And during Mental Health Awareness Month, when we have our walk, that's when people want us the most. So we end up doing a lot of outreach. For anyone who has lived experience with a mental health condition, either themselves or as a family member, most of us fall under both categories, of course, but we are always looking for people to do our youth presentations or family presentations. That means going into the schools and talking to kids or leading a presentation for families. People can also do our QPR presentations for organizations and our programs. Our programs are led by volunteers, so our support groups, our classes are all led by volunteers who have lived experience. So those are some of the opportunities we have as well. And of course, our signature events. I'm always looking for volunteers for the walk. That's our biggest event, and we always need people to help out, as well as for the film festival. So that's it for me. I'd really like to thank you all so much for listening to me and taking the time to learn about mental health. It's a topic that touches me very personally, and so when anytime anyone is willing to hear about my experiences or is interested in learning more, I'm always happy to share. And I think that mental health is one of these things that is not going away. And I'm so glad that as a society, we've gotten to a place where we're able to talk about it more, but there's a lot of work to do. There's a lot of stigma in a lot of communities still. And so I hope you will all join us. And yeah, thank you so much.
Thank you, Kate. Before we go, I really wanted to talk about two more things. But first, I want to thank you and for bringing this big aspect of breaking the stigma. And I do feel there's so much need for it because I can see it just from the point that we have almost 400 members, and this was open to this entire state. This event, still we only have 25 people here who are attending this. So you can see, and I'm not questioning anybody's time and effort, but then just the necessity of it, just the stigma around it, and that is why I feel there's more need for such things. So thank you for talking about it, and thank you for sharing all these amazing resources and the options we all have to work on those 5 ways of well-being, to learn new things, to give back by becoming a volunteer, to go to these events, to connect to people, right? And also the option of taking notice of all these things, trying to understand what these things are, what a mental illness could be, and what we can do about it. So it fits right in that parameter of well-being. So very thank you for sharing that. We really appreciate that, and we will be sharing this presentation with everybody, so you will get all the information you need about this. Just two more things. One is I really wanted to use this opportunity also to talk about something which we are doing with FES Miami chapter, which we are doing something called as traffic control or a pause. We have started doing in some of our events, and we want to continue doing it. And the idea is just from the point of the connect aspect of well-being, where we are not connecting necessarily. I know you talked about ending the silence, but the silence we are ending is from the point of not like talk about the issues, right? But this aspect, what I'm talking about here, traffic control, is about going in silence yourself, not in terms of the issue you're having, but connecting to your true self and taking that pause, taking that break from all the clutter which is going on outside. Because we all have so much going on in our lives, right? There is so much we could be overwhelmed with, and a good quick tip of breaking that overwhelming feeling or that anxiety feeling could be to take a break, take a pause, and we call it traffic control. And I know all my friends here could relate to it because most of them could be civil engineers. They're all engineers for sure, and a lot of them are civil engineers, so they can relate to the part of controlling the traffic. But we're not controlling the traffic outside; we're controlling the traffic within. So a beautiful a tool, practical tool, where you just take a break within the entire day or whenever you want. It could be just a 1 minute pause. And there's this beautiful app I really wanted to share with all the folks who are here, which I use a lot and have benefited a lot from. It's called B Zone, and it's a free app. It has a lot of the good stuff: Mind Gym, Mind Spa, and a Mood Clinic, where you can change your mood from being like, here you see the if you're upset, there will be a guided commentary to take you from being upset to being happy. But the best tool I like about this is something called as traffic control, where you can see the signal light, where you set up a reminder every hour or 2 hour for yourself, and it pops up on your screen, and it just says, let's take a pause, let's meditate. And you just take a pause, whatever you're doing. You're in a meeting, I've been using this for at least 7 8 years. And whatever I'm doing, I'm in a meeting, I'm driving, whatever I'm doing, just take a pause and focus what's going on within. Just ask yourself how I'm feeling. And what will happen with that is I'll get into that silence and I'll get into that quiet space, where I am watching myself, I'm observing myself, and I'm more aware of what's going on with me and around me, and I'm not stuck with everything which is pulling me. So just gives us an opportunity to take that refuge, to take that and connect to ourselves. So it's a beautiful tool. So use it as you wish. And of course, before we end, just want to share more about what's coming up next. We all are in this session now, and we have our next one planned on November 20th, which is from distress to de-stress. We have an amazing speaker roped in for this one. We all are going to love it. So feel free to, when once it comes out, the registration link comes out, feel free to share it with everybody. And the next one we have planned on is Jan 15th, which is building healthy relationships at work. So um, look forward for those emails as they come. But thank you everyone for attending, and special thank you to Kate and Nami. And I'm sure we will be doing something more together. I really want to talk more about with you guys about doing some of those trainings, maybe with, if possible, with our groups, or we as a group, as a Float Engine Society, could come and volunteer for certain events and give back, if possible. So I really want to talk to you guys about more about opportunities to give back and to do more in this direction as a team. So I'm sure all the members here would be interested in that and would like to do that too. So we'll connect. I'm sure we'll partner more on things like this. So thank you, Kate, and thank you, everyone.
Thank you. Enjoy, everybody.
Thank you very much, everyone.
Thank you,
Bye-bye.
Kate.
Thank you, guys.
Thank you.